I'm Dr. Kenneth Iguda, consultant gynecologist, an IVF specialist, and a minimal access surgeon. You are welcome to this episode of Ask Dr. Ken. The question we'll be answering in today's episode is, what is egg donation? What is egg donation? Remember, we have established in several series that the eggs could be called the oocytes or the ovum. It's the half part of the product of conception that a woman produces. So egg donation actually is a procedure or a kind of treatment in the IVF setup where another woman or another lady donates her eggs to another woman or another couple for the purpose of making or generating embryos to make babies. Why do people have to take egg donation? There are various reasons actually why egg donation is important, why people have to take egg donation. One of the reasons is that we have a lot of women trying to access the services of assisted reproduction, IVF, in vitro fertilization, that have advanced in age. I'm talking about the age beyond 40. But sometimes we have women lower than that age who, due to one reason or the other, have exhausted the egg bank that they have naturally, either because of premature ovarian failure or some disease condition that have depleted the number of eggs that they have. But now they have gotten married, and the desire of every couple, especially in this part of Africa, is to have babies they call their children. And so they are faced with a condition that they will have to either leave a childless marriage or having to take a donated egg to make babies. So usually egg donation is given to those couples so that they can have a chance of having children of their own. The eggs are usually donated by a group of young women, usually between 20s to 30s, because that is actually the biological age where you have good qualities of eggs. And remember, the quality of eggs is dependent on the age of a woman. As the woman gets older, the quality of egg that she has drops, and the number of eggs that she has also dropped, because it has been established biologically that the total number of eggs that the woman has are all in her the day she is born. And as the age rolls by, these eggs are depleted in number and they also deteriorate in quality. So a natural woman who is advancing in age may get to a point where she has exhausted her egg, or the few eggs that's left in her are usually of very poor quality, or even postmenopausal women who don't have eggs anymore. Those are the categories of people who are advised to take egg donation, and for them this is an option to having babies that they can call their own. It will surprise you to understand or to know that from our own observation, that the number of people requiring or requesting egg donation for IVF is even more than the number of people using their own eggs for assisted reproduction technology. This is because the social dynamics, social revolution of the world is changing. Women get married at advanced age, during which period they have exhausted their eggs, or the eggs they have left in their reserve are not of good quality to guarantee or to permit them to have good pregnancy. And so egg donation is a common practice. People may not talk about it more because they want to keep their life private, but it's good to be aware that when you get old before getting married and the babies are not coming, and you won't get past the period of fertility of a woman and you get married, one of the options of fertility treatment you have is to do the egg donation IVF treatment. Egg donation IVF treatment has its with social challenges. Some people, because of culture, religion, tend to want to be quiet or to stigmatize those assessing egg donation. But there's a whole lot of donations going on in the world today, and egg donation is just one of those donations. And you can access it in any part of the world. It's a standard practice in Africa, in Nigeria, in European countries, even in the United States of America. Yes, but just they are controlled by strict ethics and government regulation. So it's also practiced in Nigeria. And for more information, you can contact us at House Hospitals and Diagnostics. You could also visit our website at www.househospital.com, or also connect us through any of our social media handle, or better still, you can subscribe to this YouTube channel so you can have your regular update on IVF information. Thank you very much. I remain Kenneth Iguda, consultant gynecologist and your IVF specialist. Thank you.